Good day. My name is Imelda Williams. This presentation is feedback on the practice bank that I've given on the pelvis and the lower limb. Please ensure that you have your preliminary image evaluation form at hand so that you can self-mark as I give the feedback. So for case 1, we have a patient who was involved in a car accident and the request is to exclude fractures. So when we look at the pelvis, on the right side, we can see that there is a fracture which is intertrochanteric, and there's also an avulsion of the lesser trochanter fracture. And then on the left side, there is a fracture of the greater trochanter. On the image, you have calcifications of the femoral artery, but this is not the request, so we don't need to give feedback on that. And then on the lateral view, you can see that there is some displacement of the fracture. So if we go back to our PIE form, so the case is clearly abnormal. The alignment is abnormal, and the bone, because of the fracture, is abnormal. It's extra-articular, so it's just below the joint, and then there's no soft tissue involvement. So the overall preliminary image evaluation is that there is a right intertrochanteric fracture and a fracture of the lesser trochanter, as well as a fracture of the left greater trochanter. So image 2 is the case of a patient with a painful right hip after a soccer match. And when we zoom in, this is all normal hypophysis, but on the right hand side, just adjacent to the pelvis, there is an avulsion fracture, and the fracture is at the anterior inferior iliac spine. And other than that, there is nothing else of significance. So for that case, we have that it's abnormal. Doesn't affect the alignment, but the bone is abnormal because of the avulsion of the IAS, and then the soft tissue is abnormal because the avulsion is sitting within the soft tissue. So the overall preliminary image evaluation is that there is an avulsion fracture of the right anterior inferior iliac spine. For case 3, we have a patient, and it's a pedestrian who was hit by a car, and there is significant swelling and pain. So there's quite a severe fracture of the femur, and it's about mid-shaft. If we look at the fracture itself, we can see that there is distraction, and then also that the bone is displaced as well. So looking at our form then, it is abnormal. The alignment is abnormal because of the severe distraction, and the bone is abnormal, and then there's significant soft tissue swelling. It doesn't affect the joints, so the cartilage and joints is normal. So the overall PIE is that there is a right mid-shaft femur spiral fracture with severe distraction, and the distal bone is dorsally displaced. Okay, so moving on to our case 4 then. So for case 4, we have a patient who had a quad bike injury and has now presented with a very swollen knee and is unable to weight bear. So if we first look at the AP view, and if we want to check the alignment, we can see On the medial side, the femoral condyle lines up. Sorry, that line's a little bit skew with the, apologies. I just need to change this to distance, and then okay, so we can see that the tibial condyle lines up with the femoral condyle, so that is normal. However, on the lateral side, we can see that the tibia is protruded quite a bit on the lateral side. And if we look very carefully and if we zoom in, we are able to see that there is a lucency. So there is a fracture of the tibial plateau, but because of the fact that it doesn't line up, it means that this is a depression fracture. On the lateral view, difficult to actually see the fracture, but what we can see is the soft tissue sign, the lipohemathosis, where you can see that triangular lucency with a fluid level. And we can also see the density in the prefemoral space, and that is because of the hematoma. So going back to our form there, it is clearly abnormal. The alignment is abnormal, we've shown that. And then the bone is abnormal because of the fracture. It's within the joints, the knee joint, so that is abnormal. And the soft tissue is abnormal because of the lipohemathosis. So the overall PAE is that there is an impacted fracture of the tibial plateau in its lateral aspect with lipohemathosis. And I should have mentioned that this is, of course, the left side. Moving on to case 5, this is a patient who was stabbed with a fishing knife by accident. So if we just zoom in, there's nothing here that shows that there has been a fracture of the bone. However, we can see that there is something going on within the soft tissue. And the lateral view is quite useful for us here. We can see there is an effusion just in front of the patella, so there's thickening and increase in the pre-patellar soft tissue. And also, if we look very carefully, we can see that in the suprapatellar bursa, there is an air fluid level, and that is gas that's formed. And then also, and this also stretches further up in that, in the soft tissue, there's also air fluid level. So for this case then, it's clearly abnormal. There's nothing wrong with the alignment of the bone. The knee has been affected, so that's why the cartilage and joint shape is abnormal, and then the soft tissue is abnormal. So the overall PIE is that there is thickening and increase in the pre-patellar soft tissue of the left knee. There's gas both in the lateral knee soft tissue as well as forming an air fluid level in the suprapatellar bursa. However, there is no acute fracture. Case 6 involves a patient who was kicked in the left leg and has a tender leg. So if we zoom in, we can see that this patient is still pediatric. There's nothing here that stands out on that AP view. And on the view that includes the ankle, you can also see there's nothing there. And then on the lateral view as well, that is all normal. So this is a normal case. And there's no fractures. So in your general opinion then, you should tick the normal box. You do not need to tick any of the normal boxes in the specific opinion. If it remains unticked and you haven't ticked the abnormal box, then I accept that it's normal. So the overall PIE is that the case is normal and there are no fractures. So for case 7, you have a patient who has jumped from a ladder onto concrete, now has a swollen heel, and a request is for a left calcaneus. So there's clearly a severe fracture of the left calcaneus. We can see that the fracture is comminuted because we can see multiple lucencies. We can also see that there is some displacement and that the fracture is intra-articular. If you look on the lateral view, you can see the sclerotic densities, which indicate that this is also a depressed fracture. So on our forms then, the general opinion is that it's abnormal. The alignment is abnormal because of the displacement. The bone obviously is abnormal. The cartilage and joint is abnormal because this is intra-articular. And then also there is soft tissue swelling. So the overall PIE is there's a left comminuted displaced intra-articular depressed fracture of the calcaneus. Now for case 8. So this is a patient just with history of injury and gross swelling of the lateral malleolus. So if we look very carefully on the image, we can see the swelling on the lateral malleola, and this is archabus fat pad as well. But when we look very carefully, the fracture is actually on the medial malleolus. It involves the epiphyseal plate, and when you view the image, you'll be able to see especially on the AP view, that lucencies are going through the epiphyseal plate, which makes it a Salter-Harris type 4 fracture, and we can see that there is some significant soft tissue swelling. So on our PIE form, it is abnormal. The alignment is abnormal because there is some displacement there. The bone is abnormal because of the fracture. It involves the ankle joint, and then the soft tissue is abnormal because of the swelling. So the overall PIE is that there is a minimal displaced fracture of the medial malleolus, and it has a Salter-Harris type 4 fracture, and there's soft tissue swelling. And then for case 9. So this is a patient with chronic pain in the metatarsal region, and there is a history of a previous fracture. So if we zoom into the image here, we can see that there is significant osteoarthritic changes to the first metatarsal phalangeal joint. However, if we look very carefully at the second metatarsal, we can see there is a fracture, but we can also see the sclerotic changes, so this callus formation, as this is a healing fracture. So this is a chronic fracture and not a new fracture. So when we then fall in the form, so the general opinion is that it is abnormal. The alignment, there is just slight changes to the alignment on this case, and we can see that on the oblique view, the bone is abnormal because of the severe OA changes. The cartilage and joint is abnormal. So the overall PIE is that there is a chronic, or you could say there's a healing fracture to the shaft of the second metatarsal. There is no evidence of an acute fracture, and there's osteoarthritic changes at the first MTP joint. Now, the reason why I include the OA, because this is not a history of recent trauma, but more of chronic pain. And that's why I include the fact that there are OA changes on this image. So our final case then. So this patient was in a road traffic accident with a very painful swollen foot. So we're looking at the left foot. So if we look at the alignment, we can see that there's clearly some issues with the alignment at the Lisfranc joint, and similarly in that case as well. And then I just want to remove all of those lines. If we then zoom in onto the image, we are able to see that there is a fracture at the base, and this is the second metatarsal, and with a second metatarsal Lisfranc dislocation. So then in the final case, it is abnormal. The alignment is abnormal because of the dislocation. The bone is abnormal because of the fracture at the base of the second metatarsal. It involves the Lisfranc joint, and then there's also a significant soft tissue swelling. So overall, there's lateral displacement as well as a fracture at the base of the second metatarsal. This is quite typical of a Lisfranc joint dislocation, and typical to the second metatarsal. So thank you very much. If you have any questions, please contact me.